Hello everyone, this is Dr. Sam, and in this video we will study fetal bowel ultrasound images. Normally the small bowel are not visualized. Sometimes you may see fluid-filled areas in the abdomen, but mostly they are not really visible. Here we have a transverse view and a coronal view of the fetal abdomen. In duodenal atresia, the duodenum does not form properly. This will lead to obstruction and will cause dilatation of the duodenum and the stomach. This gives us a double bubble sign, in which we see both the duodenum and the stomach as two bubbles, two dilated structures. Here we have a coronal view showing us the double bubble sign. The stomach and the duodenum are dilated. In jejunal atresia, the jejunum will be dilated because it is not formed properly during embryonic development. Here you can see the normal bowel, not really visible, and over here we have an elongated and dilated fluid-filled jejunum. Now it is different from duodenum because it is longer. Here we have another image of jejunal atresia. You can see a dilated jejunum. The diameter will exceed 7 millimeters. Dilated bowel loops can occur due to atresia volvulus, in which the intestine twists on itself, or Meconium Ileus, in which there is thick impacted meconium causing obstruction. The diameter will be more than 7 millimeters. Here we have another image of dilated bowel loops in coronal view. Meconium is the term given to first fetal feces. There are a number of conditions linked with meconium. In Meconium Ileus, there is thick and sticky meconium which gets impacted to the walls of the small bowel or even the colon. This can cause dilatation, and it can also cause echogenic bowel. Here you can see hyperechoic bowel walls, very prominent. In this image you can see dilated obstructed bowels and hyperechoic bowels as compared to the normal bowel. You can see the increase in echogenicity. Meconium Peritonitis is a serious condition in which there is leakage of meconium into the peritoneal cavity. This causes shadowing calcifications as well as non-shadowing calcifications in the peritoneal cavity. Now these calcifications are usually found around the liver or around the diaphragm. Here we have a transverse view of Meconium Peritonitis showing calcifications. Now these calcifications can be shadowing or non-shadowing. Ascites can also occur with Meconium Peritonitis. Due to bowel perforation, there will be leakage of fluid into the abdominal cavity. Here we have fluid collection in the abdominal cavity. This is ascites. This can also occur with Meconium Peritonitis. Meconium Pseudocyst is a rare complication in which we will have a hypoechoic mass with a hyperechoic calcified wall. In this image of Meconium Pseudocyst, we can also see internal septations and internal echoes. These can also occur in pseudocyst. In an omphalocele, there is a herniation of abdominal contents through an umbilical defect. Here we can very easily see herniated abdominal contents in this longitudinal view. The herniated abdominal contents will be covered by a membrane which is made of amnion and peritoneum. Here you can see the membrane covering the omphalocele. The umbilical cord usually inserts into the herniated contents. Usually it inserts anteriorly, but if the defect is large, it may also enter laterally. Here we have a transverse view. The herniated contents may include liver, stomach, bowel, or other abdominal organs, and ascitic fluid may also be present in some cases. Gastroschisis is an abdominal wall defect through which small bowel will be herniated and the bowel loops will float freely in the amniotic fluid. The herniated contents are not covered by any membrane. Here you can see there is no membrane and the surface is rough and irregular as compared to an omphalocele. The umbilical cord will not insert into the herniated contents. Here you can see the umbilical cord is separate from the herniated contents, and only the small bowel will be herniated. Other abdominal organs will not be herniated. Thank you so much for watching. Please subscribe and stay tuned for more imaging videos.